Well, good afternoon, good evening, good morning, depending on wherever you are, VSG community and YouTube people. This is VSG Mitch checking in. It's been quite a while since I've made a video update, but I thought it was about time to do one. I'm currently 22 months post-op. VSG, vertical sleeve gastrectomy surgery. I had surgery June the 15th of 2016 in Geraha Kedoya Hospital in Jakarta, Indonesia with Dr. Handy Wing at the Sleeve Center there. He's since moved his practice to a different hospital in Jakarta. But anyway, he's still there, still practicing, still doing the procedures in Jakarta, Indonesia. So I thought I would just give an update on how things are going, maintenance and that sort of thing. I pretty well hit my low weight in September of last year, and in October I had a scooter accident here in Taiwan where we're living now. I rolled almost 10 meters, 9.8 meters on asphalt in a short sleeve shirt, and was pretty torn up from it. Didn't break anything miraculously, but I had some pretty good bumps and bruises, and I've got some arthritis and things in my knees, and all of that combined kind of discouraged my workouts a bit, and I haven't been as consistent in the gym since then. My low weight, let's go ahead and give you the stats. My highest weight of 2016, not my highest weight ever, but my highest weight of 2016 was about 365 pounds. My date of first doctor's visit, I was 347 pounds. In my date of surgery, I was 317 pounds. In Indonesia, they don't put you on a medically required diet prior to surgery, but I did it myself because I thought it would be better if I dropped some weight before having an operation. My current weight at almost 2 years out is about 215 pounds. I was down to 207 in September. I don't know really what my ideal should be. I know I'm a lot healthier than I used to be, and actually when I was down to 207, I was starting to look pretty gaunt, and my face was drawn. I didn't really look healthy. I look healthier now than I did then, but I feel like I could probably gain a little muscle mass, and I am back in the gym now. I've working on these again and trying to get myself into some decent shape. I've got a workout partner here in Taiwan now, in Hsinchu, and we're going to the gym a few times a week, so that's a good thing. But yeah, overall things are pretty good. It's a little bit more difficult to eat healthy, and that's something I want to talk about just briefly in Taiwan than it was in Indonesia. Now, Indonesia, there's a lot of really unhealthy food. Don't get me wrong; everything there is not steamed vegetables and grilled meats, but it was easier because there were more restaurants that were Western, and you could go to Applebee's and get the healthy selections, and you could go to Outback Steakhouse and order grilled chicken, and a lot of restaurants like that, and it wouldn't break the bank to do it. Going to Western restaurants in Taiwan, they're priced basically like they are in the West. So, if you go to the equivalent of an Outback here, which there's not an Outback in Hsinchu, but there's a very similar restaurant to Outback here. As a matter of fact, it used to be an Outback, but they changed ownership or management or whatever, and then they dropped the Outback affiliation. So, if you go there, you're going to spend $20 to $30 on a plate that's anything at all, U.S. dollars, equivalent U.S. dollars, whereas you could get a grilled chicken breast and at Outback in Indonesia for $12 or $15 or something like that, and lots of healthy options off the healthy menu for in the same price range at Applebee's. So there were more choices there, and then some of the Indonesian foods are grilled. There's there's sautés and chicken sauté and different things. Everything in Asia tends to be very carb centric though. So a lot of rice and noodles and those kinds of things, and staying away from that in Taiwan is more difficult. And for me, carbs are something I'm particularly processed flour type carbs. The breads and pastas or rice are really difficult for me to handle. I can't eat much of it, and if I do, it makes me sick. I'll swells in my stomach, and I feel really lousy. So I try to stay away from it. Protein is the rule for bariatric patients. I hate protein powders. I didn't before I had surgery, but man, my taste changed. I cannot stand protein powders. But I found one that is reasonably, moderately drinkable. Again, it's necessity, not enjoyment. Let's see. Yeah, Taiwan has a reputation as being a great place to live for food. It's a foodie paradise, and it's very true. You've got this collision of intersection of cultures where you've got traditional Chinese cuisine from the various regions around China, everything from Sichuan to Hunan to you name it. You've got that colliding with Hakka, the Aboriginal cuisine here in Taiwan. Then a lot of Japanese influence because of the Japanese occupation. Then a lot of Western influence as well. So there's, really it's kind of next level stuff. Really good food, but it's really good to eat, not really good for health. And I think you can see that in terms of, when I was here before, we lived here in 2012 and 13. You didn't see a lot of overweight Taiwanese people. There were some, occasionally you'd see somebody, but I was very hypersensitive to that at the time because I was so big. I was very, very sensitive about my weight, and I was always worried about people looking at me or staring at me, what they were thinking. So if I saw anybody who was overweight, it would be something that jumped out at me. Now you see obese Taiwanese people every day. They're a dime a dozen, and I think the cuisine has something to do with that. I think the evolution of dining here in Taiwan, combined with maybe the work schedules that people have that are so rigorous and difficult. There's seems to be a larger number of fast food places now than there were, and then even more than that, there seems maybe the ingredients are not as the high quality as they once were. Not as much stuff is fresh, and there's a lot more people eating the cheap dumplings and cheap noodles, and because you can if you eat dumplings and noodles, you can eat for $5 a day, thereabouts for your meals. So it's possible to eat and live here very cheaply. By the same token, you can eat for $3 a day in Indonesia if you're willing to eat 3 meals of fried rice. Nasi goreng is about $1 for a plate. So it is possible to eat really cheap, but your health is going to suffer. And I think you're seeing that somewhat. Inflation may be playing a role. Stagnated wages, but yeah, it's is what it is. That's pretty much it. Things are going pretty well. Like I said, I would like to drop maybe another. I've got a little bit of, this is my loose, the skirt, so to speak. I've got a little bit of weight I'd like to drop still, but overall, I'm pretty healthy and pretty happy. So I hope everybody out there is the same. Be excellent.